Hi, my name's Jessica. I'm a clinical nurse consultant with the Region-wide Services team. I've worked at EPC for the last 5 years across multiple different teams. My role at EPC is as a clinical nurse consultant, and that involves providing clinical leadership to the aged and disability care team of nurses, the intake team of nurses, and the nurses who work in our afternoon shift. I completed my first nursing placement as a uni student at Bethlehem Hospital when I'd been doing my degree for about 3 weeks. It was very intense when I was 18, but I remember the compassion and how calm the nurses were who were working there. And I knew even then that palliative care was something that I'd like to do once I gained a bit of experience and a bit of clinical experience and life experience. So when I did apply and started working at EPC, I was quite regretful that it had taken me so long to get here. I started at EPC as a nurse in the inner team, and then I moved to the central team to be a little bit closer to home. And then in 2022, at the end, in December, I had a lot of support from the senior management team at EPC to apply for the clinical nurse consultant role. I've always been drawn to leadership roles, and I was very motivated to support the nursing staff within EPC to be able to provide the optimal care to our clients, as well as to help them to maintain their own well-being. I'm quite a big sharer, so there's not many things that people don't know about me. We do have a new addition in our family. My son saved up and purchased a snake. So now we have 3 cats and a big 60-kilo dog and a snake as well. So it's quite a farm at my house. So there's ebbs and flows with the day. The start of the day is incredibly busy. Our team prioritises visits for the aged and disability care teams. We review any new referrals that have come in that may involve urgent matters, and we follow up with urgent things from the day before. The middle of the day involves meetings, project work, and time with my team to discuss process improvements. The afternoon is spent organising work for the evening staff, debriefing and assisting the intake team when needed. I really enjoy the clinical work at EPC. The complexity of the symptoms experienced by our clients can be very overwhelming, and it's really satisfying when people's quality of life has been improved by the interventions that we've been able to put in place. I also really enjoy motivating and developing the nursing staff. We have nurses with an incredible amount of skill and experience and knowledge, and finding ways that they can confidently work to the maximum of their scope of practice is the best part of my leadership role. I'm a mum, and self-care is not always easy as a working mum. It's hard to remember to structure time for the things I need to prevent burnout. I've learnt to prioritise this most of the time in order to provide a good example for the other nurses as well as for my kids as well. I'm really inspired by my parents. They started their life together with very little, and they worked incredibly hard and made lots of sacrifices to build successful careers where they're both highly regarded, as well as a big, crazy and loving family. They've taught me the importance of prioritising family and working with purpose. EPC is incredibly passionate about keeping the care for the client at the centre of everything we do, and I've never worked at an organisation that is so responsive to meet the needs of the client. EPC also invests in its staff. I was blown away when I started to learn that each team is allocated multiple days across the year to come together and reflect on the care that we've been providing to our clients, and also to connect with one another. It's important to recognise the stress that comes from caring for others, and at EPC there's a lot of continuing work going on to develop new ways to support the staff.